are there other symptoms that if somebody's having that would point to you or just give you clues about the underlying cause of their pelvic pain? So, for example, maybe if it's like pain that's right before their period versus if it's pain when they're on their period versus during ovulation.
So, the endometriosis pain is, uh, so yes, dysmenorrhea, we call it if it's really just, when you get your cycle. However, a typical endometriosis pain often actually starts up to a week before you really get your menses. And then the moment you start to bleed, it actually gets often better. And then there is, I want to say, and then there's ovulatory pain that also stops many women in their tracks. And that, often gets worse as we approach our mid-30s. And I think this is just, the reproductive aging settles in and our hormone surges, as you might know, become actually first more pronounced. So estrogen rises really hard. These women then often have more ovulatory pain. What I like to call the ovary was just really stimulated really hard, that follicle. And then I always say it happens, you might have like a more violent ovulation. These women often end up in the emergency room, right? And then they're diagnosed with what's called like this ruptured ovarian cyst. So then people always walk around with this label, like they always say, oh yeah, I tend to have ruptured ovarian cysts. And I'm like, yeah. So, you're probably ovulating a little bit on the harder side, and it has to do. Yes, there can be underlying endometriosis. However, it can also just have to do that the hormones are a little bit unbalanced. Okay, we have issues with getting rid of excess estrogen, basically. That's when we get heavier menstrual cycles, we get more PMS, we get more breast tenderness, potentially. And then, of course, not to forget pelvic infections. Well, that can cause chronic pelvic pain, and it doesn't have to be an acute pelvic inflammatory disease. It can be what we call like a subclinical endometritis, basically like lingering infection of the endometrial lining. And that doesn't mean we are dirty. It doesn't mean we have an STD. Most pelvic inflammatory diseases are actually not caused by an STD at all. Most of the time, it's just an ascending, so meaning it crawls from outside to inside up the vagina, and ascending, what we call gram-negative bacteria are causing that. Basically, just random bacteria. And I think that's important to understand.